Welcome to the Myofascial Health Podcast, hosted by me, Unu. Follow along as I explore the depths of John Barnes' myofascial release approach on my road to mastery. Along the way, I'll be sharing the lessons I learned as I open my myofascial release practice in Austin, Texas, so that you don't have to make the same mistakes I do. Welcome back to the Myofascial Health Podcast. Now, I'm joined here by a very special guest. She's been a physical therapist going on 27 years, an MFR therapist for 25 years, a business owner since 2003, the author of The Joy Mastery Method. It is my honor to introduce Kate Furnish. Thank you so much for joining me on this podcast.
Thank you for having me here and for doing this for all of us to listen to. It really helps keep us connected, and it's such a sweet topic to be bringing into the world.
Yeah, the thing about that is I wanted to keep up with it because it keeps me tied to myofascial release. I think business and life can get a little bit occupied, and I know this is something that brings me a sense of joy. And so that's what I do it for. And then when I get to connect with like-minded therapists like yourself, it just makes me remember who I am, the things I'm doing it for, and it helps me stay grounded and centered. So I appreciate you even listening. Now, let me just ask, how did you first get into myofascial release?
Oh, that's a good question. Well, I've heard some of your story, about the skepticism you had initially and the questions and how maybe you were part of the 3-question limit in the myofascial release community. So I was in PT school when I herniated a couple discs in my back, in my lumbar spine, and I was in a lot of pain. And it was my last year of PT school, so I guess the last year and a half, and you feel like you should be able to figure it out. Like, oh my gosh, I'm going to be a PT, I'm supposed to be helping people with this, and now I have this pain that I can't figure out. And then consulted with professors and physical therapists, and they tried many different things. And this searing pain going down my leg just didn't stop. It could be affected a little bit. And I stood very straight. I had great posture. I did all the things and became afraid of my life. Really, I didn't sit down. If I wanted to go to a movie, I wouldn't sit the whole week so I could handle 2 hours sitting. And I don't know if, I'm sure some of your listeners have been in pain like that. You just start to constrain your life. You're like, what do I have to do so that I can function? But I was at the beginning of a PT career, and I have to lift people and move and do exercises, and I wasn't feeling hopeful about that. And so I was on a pediatric rotation, and one of my supervisors had taken John's classes, and she would watch me move, and she said, I need to treat you. And so one day she said, tomorrow after work, I'm going to treat you. And we were in a pediatric practice, and it had this sensory room with a bubble tower and lights. And she just had me lie on the floor and took my head in her hands. That is all she did for 30 minutes. And my pain went away. Now, it came back, but nothing had taken it away. And it was away for long enough that I realized this had powerful effects. And it's not that she was doing nothing. She was doing myofascial release. She was moving my head, but that was amazing to me and a little bit scary. I wasn't sure what this was.
So when you said it was scary, what allowed you to stay in the moment? Because I think a lot of times when we brush upon this feeling of fear, that we will try to avoid it. And you were able to just kind of lean into it. What allowed you to do so?
Yeah. Well, I think a lot of that fear was just in my mind of you're being trained in a very linear way in school. And then there was something that was so powerful and felt almost magical that I didn't understand and couldn't grasp, but had a deep experience of immediately. And so I knew there was more.
That's awesome. I think when you're on this pursuit, oftentimes we are led down this path to get more knowledge, right? We go to PT school to learn these things that are we're told is going to be able to help people with their pains and their injuries. And it can, but oftentimes it's very limited. And I think it didn't take me very long to try some protocols that we were taught and it not get the patient where I thought that they should be, you know? And I think when you have a personal experience with an injury, like yourself and like myself, that adds a layer of compassion that I don't think that if you never had that, you'd be able to connect with someone over. I think those of us who have dealt with injuries for a long period of time, when we treat a patient or a client, there's definitely this empathy that we have for them versus if you've never had that and you've gone through PT school, everything that you think is going to help is from a textbook. And so it's cool to hear that you had gone through the experience and it didn't give you the full result, but it was enough to say, hey, something had changed it that nothing else ever did. From that moment on, were you totally convinced of myofascial release or did it take you some time?
It took some time. I was still on that rotation, so I would work with that woman. And even after I graduated, I worked there for a while. So sometimes she would look at me, she's like, "You need to unwind." Like she could always tell before I could tell. She was just very masterful. And so I was having experiences with it and still had not gone and taken classes. And she was encouraging me to do that. So it was really another accident that I was like, okay, this is more full body, everything I need myofascial release. Um,
Okay, and that's such a great. Okay, when you get to the point where you say to yourself, "I need myofascial release," not "I want it," not like it could be good, but I need it.
yeah.
There's like a total acceptance of it. Can you tell me more about the bigger accident you mentioned that you're like, "I need this now"?
Yeah, absolutely. So I had a skiing accident where I hit a tree and I broke my pelvis in 6 places and shattered my elbow. I had thrown my elbow up in front of my head going into the tree. I don't know. I passed out right away, but so many miracles along the way, like ski patrol was right behind me and they got to me really fast. And as I was coming out of that whole experience, I did do traditional PT that focused, the only place I had surgery was my elbow, and that's all they were looking at. And I was like, well, there's a lot more going on here. And I had broken a couple ribs, and I knew I needed something that would look at my whole body and that myofascial release would do that. And that's when I started taking classes. And it's not as altruistic as I just went for my patients. I just wanted to heal and it was time. And when I started taking those classes, I was like, this is it. Like this is what I have been searching for. This is what I want to do. And it's incorporated into every treatment that we do because it's not just when you put hands on somebody, it's how you walk in the room and it's how you view a person as a whole being. And I loved that. And so that's really what sold it for me. And and it was effective and I was healing and I was connecting to my body. And so when you talk about leaning into that fear, I was like, well, I don't know, but if I can believe that there's more than I can know or figure out and be open, then amazing things can happen. I mean, I don't think we get into PT thinking the body can't heal, right? But sometimes we have those experiences with people where we're doing everything traditional and we're not getting the results. And then with myofascial release, you just have this way of engaging the patient in their own healing process that is so powerful. And as we open to that more, we start to expand not only our lives that have gotten smaller from the pain, where we start to constrict and constrain, we start to expand our consciousness, our awareness, our lives, so that we're actually living and expanding rather than deteriorating.
I couldn't have said that better. And you touched on two words, consciousness and awareness and expansion. which I don't hear very many PTs say, and I know that in the myofascial release spaces, this is like common conversation because you can't separate the human being into small components and say, hey, we understand you because we understand these small things. Just like you said, it was because we were able to look at the whole human body and the whole human being that we're able to deduce and use maybe the energies around that and how you even walk into the room to be able to help somebody. And whether they can verbally recognize that or not, it is something that is felt on an energetic level. The thing that comes to mind is John hated this idea of like the reductionist model of thinking where we break things down into smaller and smaller components, and we believe that if we understand them at the smallest components, then we understand them at the biggest components. And that's not necessarily true. It takes something like myofascial release, where we say, hey, this is the whole human being. I'm not treating an injury. We're treating Kate, and she is a skier, and all of these other things. How can we help her? And I'll say that for myself, we don't get taught that in PT school. We just get taught the anatomy. And that definitely has a place. I think for myself, I know when I first started learning about myofascial release, John's PT background and Rob's PT background made me feel like, okay, these are my people. It's a little bit odd. I don't know if I fully accept this, but hey, they've taken the path and they know what I've gone through to learn the things. And I feel like the PT background helps me stay grounded, but inevitably, when you see something like an unwinding and your complete logical reasoning gets thrown on its head, you're like, okay, there is something here that I can't necessarily put into words that I've learned from a textbook. But all I know is when people get up from that, it seems that they feel much better. When you talk about unwindings, it sounds like you had your own experience in your pediatric rotation and then you saw it again in class. Is that right? What was your experience with unwindings?
Yeah. Oh, I love what you're saying, and I want to highlight one thing of, you know, we're on both sides of the table. And I think that makes a difference. When John trained us, he didn't just talk to us. He let us experience, and in fact, encouraged us to experience being treated as much as being, sorry, being treated as much as treating people, because you really do have to experience the letting go into what is and what you're feeling, which is not what we're taught in our culture, right?
Mm-hmm.
In most cultures. And that unwinding is born out of feeling what's there, not only emotionally but physically, and tuning into your own body. How does it want to move? But not from your brain of thinking like my shoulder wants to reach overhead. It's an internal feeling. If we can connect to that, oh, as I quiet down and come into my body and sit with myself, oh, I feel a little bit of tension in my mid back, and I just want to stretch and turn. And you start to be able to connect with your own self in that way. And so unwinding can look out of control or chaotic or wild or emotional to people that haven't experienced it or seen it before. And I know for some people it can be scary because we're not taught to let go of control. And for me, it was like coming home. It was like, oh, there's that scream that's been inside me my whole life that I didn't think I could let out. And there's other people that have that, that have those screams or whatever, like, from some childhood trauma. And in my case, that things I just carried that I thought I had to carry and carry and carry. You can set it down, you can let it go, you can express it, you can feel it, and you can move on. I mean, what is more powerful than that?
Nothing, in my opinion. I think for those of us who've been able to experience it, it's something that is again, it's a feeling experience. It's not anything that we can really say that anyone who hasn't experienced it will be able to understand. It's kind of like riding a bike, right? Like I can talk about hey, this is how you're gonna ride a bike, and you gotta balance and look across the street, and this is the brake, and you gotta pedal. And it's not until you jump on the bike and you're like, this is what riding a bike is. And for this unwinding experience, I love the way that you put that. It's just, you're just waking up something that's always been there. And once you go through that, it allows you to release these things that have been repressed. And maybe it was coming from a place where you felt unsafe to actually do those things. Something that you mentioned was something called childhood trauma. Can you elaborate more on what that is?
Sure. I mean, people and any I mean, our perception and perspective also affects things, right? And so we can talk about the lenses through which we see life.
Yeah.
If you haven't felt safe, you're going to look for what's not safe and you're going to be vigilant in certain circumstances, or if it's enough trauma, in all the circumstances, right? So trauma can be anything from sexual abuse to physical abuse, emotional abuse, even rapid rates of change can be traumatic for children, right? Not having a sense of safety and security. And usually, not always, but a lot of times, there's nowhere to process that. And Unu pointed out something really important that, when we go through a traumatic experience, sometimes we leave our body because it's a wonderful, graceful coping mechanism, right? It allows us to survive. It's just meant to be temporary. If we leave that body for 10 years, that's not great. It leaves us uninhabited. And it's not that our consciousness isn't near us and we aren't sometimes in our body, but that scooting out and unprocessed and unresolved trauma, it's like it's constantly happening on a subconscious level. And it's exhausting. Like if you're going through life, we talk about joy and you have such a joyful presence and you're so excited when we talk. I love talking to you. And when we go through life and we're exhausted and just the littlest things seem hard, that might be a symptom that you have some unresolved trauma in your system. That there are things going on in the background and we're not aware of them. If we were aware of them, we would handle them, but they're happening. That's what subconscious means. It's at a subconscious level. And sometimes you need someone to sit with you and be with you and help you quiet down so that those things can bubble up and come to the surface and be released. And so that's like not a great selling point. People are like, oh, shoot, I'm not sure I want to do that. I'm not sure I want to go to those places. Those were not fun places. And it's not that you have to feel every second of every trauma. That's not what we're saying. But when you are witnessed and when you can go to those places and touch them or just dip your toe in the water in a safe place, you start to release some of that energy that is holding you and constraining you. And you become free. And that, we hear that word a lot. You were talking about riding a bicycle. I can think of that feeling of freedom. I loved when I was a kid before there was helmets. Loved the wind in my hair. We talk about that, but really being free, that's powerful and it's possible.
I couldn't agree more. And the idea of being free in your body is one that is understated. I think people just say, oh, I'm getting older, so I just feel like these aches and pains, or I'm just tired all the time. And that's the acceptance of their reality, maybe a lens that they're looking through. And to touch on that more, I think you explained it beautifully, but childhood trauma comes in different forms. And the way that I like to think about it is there's big T trauma, like a capital T. Those are the things that happen to somebody that makes your stomach curdle. It's like if someone had sexual abuse or something like that. Oh man, it just doesn't feel good in the pit of my stomach. But there's also little t trauma, which is like, oh, you felt neglected or you felt unsafe. And these things can happen, and oftentimes it's not always intentional, but you never had this place as a kid to express these emotions, or at least I and a lot of people that I've spoken to don't have this freedom because what you're trying to do is maintain this attachment to your parents. And so sometimes you feel like you have to act or perform in certain ways so you don't lose that attachment. So yelling and screaming and crying, if that was punished, then you learned not to do that. You learned to stuff that down. And what we realized is those are just emotions that every child and kid has. And if they don't have a safe place to express that, then what ends up happening is that solidifies into this fascial system, the ground substance, and you carry that with you. And that takes emotional energy. On top of that, that might shape the way you view the world, this lens that you're talking about. So if you're always scared because you're going to be punished or you're having to perform, then you go through life not being yourself. You're doing things to perform and try to please others because that's all you've ever known. And it takes someone like a myofascial release therapist to say exactly what you said. I love the way you said it. Just being there with them, allowing them to feel those things, allowing them to bubble up at sometimes. And yes, some of these things are very, very intense, and I can totally resonate and understand if someone's saying, I just don't want to go back to those places. But then the alternative is okay, then you're just going to continue carrying this for the rest of your life. And I can guarantee it's going to affect your adult relationships because you're looking at it through that lens. And unfortunately, that becomes what bleeds on the people around you. And sometimes all you need to know is like, it's okay. It's safe to feel these emotions and you're not going to be punished for them. But sometimes that's what we've been trained to do. And so I think ultimately you wear this straight jacket that John talks about. It's emotional, it's subconscious, and your subconscious is 99% of the program. The conscious mind, which you can physically see and rationalize, that's only 1%. And sometimes we give so much value to that conscious mind, that 1%, but we are discounting the subconscious. And I think something that's interesting is we call it the subconscious, like it's under that, but really it's the bigger piece of that. And you'd be surprised at how many things we do on a subconscious level that we don't even recognize that just plays in the background. Until you become aware of it, you just constantly go through life and say, oh, this is just the way that it is. And awareness is a huge part of myofascial release. Being aware is being centered and allowing things to play out the way that they are, not the way that you kind of project onto them. What would you say is awareness to you?
Oh, wow. Okay. I mean, mic drop. Everything you just described, amazing. Awareness to me is ever expanding. And it's through I'm going to tell a little quick story about my relationship to pain to illustrate that. When I had those herniated discs, and all of a sudden I went from feeling great to feeling in pain every day. I couldn't get comfortable at night. I couldn't get comfortable during the day. Movements hurt. I had to use really good and careful mechanics not to hurt myself more. I started to be in fear, be in that straitjacket. And that's just on the physical side. Okay. I mean, there was mental pieces too, like, oh no, don't get hurt. Why can't you figure this out? You should be able to figure this out. You're going to be a terrible PT if you can't figure this out. How are you going to figure it out for anybody else? Like all those voices. And then, I'm sorry, my dog's gonna bark. The pain felt like a life sentence. Like, how am I gonna get out of this? And when I started getting treated with myofascial release, what happened with pain was it's at the end of the story, it's my friend. It's a signal. It tells me something about my body. I started to be able to hear its whispers and respond before it was screaming at me. And so I'm so sorry. We think that things are happening to us, but what if life is happening for us? And so what happens is that treatment, when someone is with you and you're feeling your own body, you start to learn how to feel what's there and you start to become friends. When you're in pain, you're kind of not a friend with your body. You're mad because it's hurting and it's mad at you because you're not taking care of it, and maybe you don't know how. And so it's like you're at odds. But when you start to listen and you start to be treated, then you can hear the signals and start to interpret what they mean. And it's like you're creating a relationship between your awareness and your body. So, what is awareness to me is like the sweetest way to love ourselves. Can you take a moment to just put your hand on your heart or take a deep breath in your body and feel what's there? It has so much beautiful information for you. Can we start to listen to ourselves? And as we do that, as you pointed out, it affects all our relationships because if we can listen to ourselves, we might be better at listening to another.
100%. You put that so great. And something that I believe that you mentioned is if you listen to your body when it whispers, you won't have to hear it scream. And I love that you're able to describe how you can have this pain and you can also befriend that pain. And it's almost like your body and your awareness are two things that are intertwined. And you're able to kind of speak on when you're one versus the other. And I think that's because you developed this relationship to your body because you've gone through these pains. When you are at the beginning stages where you're like, dude, I can't feel better, everything I'm doing is not working, and then you even start to question your own identity of, man, if I can't fix this for myself, how can I call myself a PT? How were you able to work through that?
Well, I think I just kept one was keep going, never
Okay.
give up, right? And I think it was those were foundational questions and maybe for all of us like I'm in pain, can my body heal? Do I believe that? Now I have a mantra like I really believe we're hardwired to heal. When
Mm.
we cut our finger, we don't worry about it and worry what we've done wrong and how's our life going to play out. We don't even sometimes interact with it even with a band-aid. We might wash our hands and it just heals. Like that's a miracle right there. It just heals. Well, if that can do that, why can't the deeper pieces heal? Why can't a broken leg heal? Why can't a herniated disc heal? Or a broken heart? What if we are made to heal? And if we can believe that, it changes everything. And it doesn't mean we aren't going to walk through challenges and painful things. There are challenges. And if we can use those to know ourselves better, to connect more deeply to ourselves, even if it's not a perfect outcome. Because I'm not saying everyone's going to walk through their life pain free and you're never going to have a struggle. Oh, that's what myofascial release will do for you. No, it will help you walk through your life, which will have ups and downs, which will have struggle and highs and beauty and joy and love and all the things. But we can do that connected to ourselves or we can do that disconnected. And I'll tell you, connected is a lot more fun and more productive and more expansive than just moving out of the way of the things we don't like. Let's take up space in our lives. Let's be there. Let's be in our bodies.
I love that. The word that comes to mind for me is authentic. I think if you're able to be yourself, and I know that a lot of times we feel like we might have to be somebody else, that takes a lot of energy. You get used to wearing this mask or pretending like, hey, I'm not in pain. But underneath, if you really are, like that is who you're having to really look at in the mirror. But then when you interact with the outside world and you have to play this role, it gets exhausting and something has to give. And this is where I think when you talked about how, oh, if you just don't find that you have the energy to do things, you're just tired. It's like, hey, maybe this is something that you're not steering yourself in the right direction of. Maybe that your body is saying, hey, this isn't what's giving us this joy or this positive energy that would be steering us into the right direction. Oftentimes, that comes through our intuition. And it can be very tough to trust sometimes, but I think authentically, when you are acting from that place, your true intuition, your life will unfold in ways better than you can possibly imagine. And I'm speaking from personal experience because I grew up playing soccer pretty competitively, and I had these dreams and aspirations of playing in college and maybe on the Olympic team. And then I tore my ACL multiple times. And that ultimately led me to meeting a physical therapist for the first time. And because I was into academics and athletics, it was the first time I saw this career where I said, wow, you could do both of these things. I think I could do this, and I think it could be pretty well. I could do pretty well at it. But it took an injury, which was so disheartening in the process. I felt isolated and alone from my friends and fear of missing out when I saw them playing, and I had to sit on the sidelines. But that was, when I look back on it, just a blip on the map. You know, it wasn't this huge thing, even though it felt so big in the moment. And ultimately, it led me down this path that I couldn't have even imagined at that time. And so I had to get out of my own way. And sometimes that comes at something we look at and say, oh man, that's misfortune. I'm so unlucky. But those misfortunes, these ravines or these downswings of life are actually part of the process. And when you learn to accept it all versus saying, oh man, it sucked to be there, and you kind of mope and you dwell on it, it doesn't help anybody, especially yourself. And so I love that you accept both of it, but being able to be connected to your body versus disconnected, that's a huge decision that you honestly just make. And I think sometimes you just get so tired of playing the role that you're saying, dude, I just don't want to do this anymore. And then what you end up having to do is like, oh, but everybody knows you as this person. So then now you have to make those bigger decisions of like relationships you choose to keep around or not because you played this role, you know? It's easy to say, hey, they see me as this, but honestly, when you look at yourself in the mirror, you say, I played this role that everybody saw me as, and now that I'm choosing something else, those relationships often get intertwined with that. Do you have anything to share on that?
Yeah. I mean, you're going so deep and I love it. I feel like I'm in a treatment session right now with your beautiful heart and understanding of how these things happen and how we do try so hard. And I think that's something in our youth, like we're trying to belong, be accepted, be attached to our parents, all the things, or in our early careers, right? We're trying to do it right and be good. And whatever we defined that as meaning, we're going towards that. And everything you're describing, and so life is longer than we think, usually. But what feels so big in the moment, because those were your dreams, that was soccer, and you wanted to do that. And it feels like it's being ripped away. Can we surrender to what is happening in life? I think that's something myofascial release gave me in learning to surrender to the moment and what I was feeling. On a smaller level, you talked about, John, don't just break it down to the smaller level, look at the bigger level. Well, doing that on the smaller level in my life opened it up on the bigger level. Can I surrender my life as a whole? And can we talk about our soul? Like, is there a purpose here? And is there a calling? And is there guidance that happens for us so that we can find the deeper meaning? There's a song by Laura Story called Blessings. And she said, maybe our blessings come through teardrops and our healing comes through pain. And that we pray for peace and success and etc. And she said, you love us way too much to give us those lesser things. Like, when we come into who we are and our soul, when we can surrender and go, there's more here than meets the eye, and there's more than we've been told. And because we're feeling all of that, even without being able to describe it or have words, and you've done such a beautiful job today giving us words for this, we feel the angst. There's more to me. I'm bigger than this life lets me be. And how do I break out and how do I shine my light? And maybe some of it is this surrender, this act of surrender that actually claims a life bigger than the life in 3D. But we're moving into 5D and 12D and the dimension of our soul. And I remember in my accident, I had a thought in the hospital bed. I was in the bed. My husband was sitting to the left. The doctor bounces into the right, like all happy, like, how you doing today? And that was great. I loved that he was happy. I'm like, not so great. But the voice in my head was, this experience will be a miracle in my life. And that's not my usual voice. My usual voice would be counting the cost and being upset and it's not going how I thought it was going to go and what's happening. And I really believe that was the voice of my soul. And because I decided that this experience will be a miracle in my life, guess what I saw throughout the experience? All the miracles. The miracle of finding myofascial release, the miracle of standing up out of the wheelchair, the miracle of the first time I could get myself in and out of bed, because that was weeks. The miracle of that quiet time, the miracle of rebuilding a pelvis that had been traumatized earlier in life. I got to lay in bed and rebuild it cell by cell. That was so good. The miracle of my daughter would come home from school and get in my bed with me, which was in the living room, my hospital bed, and having that time with her. What if it's all a miracle? What if we can accept what's happening in a different way and look for the good in it? And give ourselves a place to feel and process the reality of when we fight against it and when we don't like it and when it's unhappy and when we wanted something else. Like, you get to throw the tantrum, right? I wanted this and it hurts that that's not what I get. And maybe I get something even better.
I love your perspective. Something you're saying is I get to go through these experiences. I got to go through this terrible experience, and it shaped the rest of my life in a positive way. And I think that when you talk about surrender, it's actually for a positive, better thing. Whereas typically when you hear the word surrender, let's say like in war, it's you're giving up. Can you differentiate between the two for yourself?
Yeah. I think there is a giving up in both, in that for me, surrender was I have a strong will and I wanted to figure it out. I like to figure stuff out and I wanted to do it my way.
Yes.
And I thought that was pretty good. And when I did surrender, finally things weren't working enough and I was miserable enough to go, maybe there's more to this than I'm seeing. And I can't really figure it out enough to get to where I want to go. And I feel like I'm making myself miserable, maybe even the people around me miserable, because I want them to play certain roles or I want my family to be a certain way, whatever. And when I surrendered, I was like, really this attitude of I can't see the whole picture. I can't do this on my own. And I want that joy and peace and love and beauty and happiness enough that I'm willing to say what I'm doing is not working. And I'm willing to believe that it still exists, that I wouldn't have this desire if it wasn't there. And so can I let go and believe it and surrender? And I'm kind of almost I'm emotional here because I'm just realizing at another level the gift of John Barnes and what he's given us through myofascial release. I remember him on stage in a class talking about flowing with life. I was not flowing with life. I was doing what I was taught. I was making my goals. I was going for it. I was working hard. I was going to get there. And there was no flow, just effort. And as John's talking about flowing with life, I can feel his presence and I can see his body as he talked about it. And he was moving his body as though he were flowing down a river. And he said, we can flow with life. And we co-create. It's not like we're going to go right into the boulder. We can shift a little and go this way, but the current is still taking us. Like, are we in this greater thing called life? You're breathing right now. You're alive. And even if you don't do it on purpose, it's going to happen. That's a beautiful thing. So while you're alive, do you want to just constrain it and try to make it work out? Because there might be something more. And if you can start to surrender to the flow of life through you, it gets much easier and it becomes an adventure instead of a disappointment. When you need it to be a certain way, it is frequently a disappointment. because it is hard to miraculously put all the pieces together to get that certain way. But when you can surrender to the current of life, you can flow with it, and it can be more than what you envisioned.
Absolutely. I have another quote that comes to me, and it's no expectations, no disappointments, right?
Yeah.
If we have this idea of how it's supposed to be, and I say it's supposed to be in question or in quotations because that's when we have this bias, and then we lose out on everything else that is there already trying to help us. And like, I love the image that you said of John saying, "Can you flow with life?" Because flowing with life means you're accepting you're a part of this bigger thing. This, whether it's the universe or God or energy, whatever you want to call it, you are a part of that. It's not just you. And when you can feel that, not just say that, but when you truly feel that you're in the flow with life, everything gets a lot easier because everything is working for you instead of you saying it has to be this one way. Now, you bring up John and you also mentioned about your pediatric rotation of these quote unquote masters. What is a master or mastery to you?
Yeah. I'm just going to touch back to what you said earlier because you talked about intuition, and John would call it channel 3 too. He would say, channel 3 is a beautiful place. Come join us. And I think that's part of what allows us to flow, is that intuition and that guidance, being connected to ourselves. And mastery really is, John would say, maybe the meaning of life is being in the present moment. And he would talk about always being a beginner. See, a beginner is fresh and in the present moment. So it's not that you're discounting anything you've learned or your wisdom, but if you can bring all of you into the present moment, that's part of mastery of life, because then you can experience the present moment. And we go from, I would say, I'll give you my journey, early in this journey of trying to control it all, to stay safe, to make it happen the way I wanted, whatever. When John was doing that thing about flowing, he said, we co-create. You become a co-creator with this channel 3 or divine energy or source of life, right? You get to have an opinion, you get to have desires, but they're not constrained in the same way. They're open. And so things can be orchestrated on that level for your highest good and for more than you can imagine. So now I'm hoping I'm answering your question, but all those pieces come into play of that, where it's a very different place. And I think we are really being called now to be in that alignment and authenticity, and to discover our soul and awaken our soul, that there's a life beyond the 3D physical world. And I think we need to bring in light, and we need to bring in love, and we need to bring in who we are, because just being who you are, let me take a little pressure off our listeners. Just being who you are changes everything, changes the world. We need you. You are so loved and so beautiful and so essential. The uniqueness of your soul and your essence, it changes things.
Absolutely. Again, back to authenticity. You emit a very warm energy when you're just being yourself. When you're trying to be somebody else, it's like it gets broken up. And I love the way that you explained mastery. And it's often just feeling like a beginner again. And so I know I've retaken many classes because I feel like a different person, but things will sound a little bit differently to me. Or because I've gotten more experience with the work, now I understand it on a deeper level. And it's just being able to see through the eyes of a child where everything is so new that you start to piece those things and accept those things and they become part of that experience. And I wanted to ask you about mastery because I wanted to know what your joy mastery method was exactly on that topic.
Yeah. Yeah. And mastery is coming back to it over and over and over again. And the question I would ask is, what are we cultivating in our lives? So when I talk about joy mastery, it really is mastering the cultivation of joy. Can we come to something over and over again until it becomes a part of us rather than something outside of us? And even being centered, when an airplane is going from A to B, it's not always on the path. It's a little bit off here and a little bit off there, but it keeps coming back to the navigational path. It's not that we get off center, it's how soon do we come back. So really the joy mastery method is founded in myofascial release. The 3 steps are to simplify, stabilize, and source your life. And the ways we do that are to center and ground and expand. And the book walks through each component through a physical, mental, spiritual, and emotional level, just for the purposes of conversation, but with the understanding that those aren't separate. It allows me to give you practices in each area so that you can practice it and discover what brings you into your center and what grounds you and what expands you and brings you into your joy. It's really just a stepping off point, right? It's going to give you stories and practices and theory and encourage you. How do you become centered so that your life becomes simpler and more clear? How do you become grounded so that you're stable when life blows around? And how do you become expanded so you're connected to source? You're in channel 3, you're connected to your intuition and your divine guidance. And so I hope that people will really enjoy it and recognize it. And it has some MFR stories in there too.
And who is it for?
Oh, well, I mean, it's kind of written to the woman who manages it all and secretly wonders when she can enjoy her life, taking care of everybody else. And really, the person that is feeling, like we talked about, some of that exhaustion that you can't explain, feel like your energy's not all with you, the person that feels overwhelmed and harried and pressured, the person that's trying so hard to make it work, that's ready maybe for a new way. And I say in the book, I needed a new way, and then I became the new way.
Something that comes to mind is you brought upon this concept of purpose. And I know I have a sense of purpose as I navigate through life, and it helps me make decisions. And I'm not just playing the pros and cons and trying to analyze everything to say, hey, this is the best way. And that sense of purpose, I know not everyone gets to pursue. And I'll just say for me, it is just making everything way easier because if it brings me closer to my purpose, I know it's the right decision. If it takes me away, I know it's the wrong decision. And it's this idea of like just simplifying it as much as you can. And something I love about all the things you shared is honestly your perspective. It seems as though you enjoy where you're at. And these things that might seem like they're terrible, like a huge accident, you are grateful for those moments. And I think when someone doesn't have a purpose, they're kind of going along with life. Instead of going with the flow, they're just trying to find themselves. And I'll say that I think that the purpose of life is to go through these challenges and obstacles. And they're going to be trying. Like, it's going to be very trying moments. You might even want to give up at times. But as long as you never lose your faith that it can be better. And that's something I loved in your story. You're like, I just knew that there had to be something better. I believed that my body could heal. That when you find those things that help you overcome these obstacles and challenges, you now have the tools to help somebody else. And I think you wrote this book because you've gone through these trials and have seen the better way. You've gotten to the other side and seen the light. And now you're able to use these experiences to help those who are just that step before to help them cross that bridge. So I just want to say thank you so much for joining me on this podcast. I know that I got so many reminders and memories of John or just your story that helped me look through the lens of positivity and gratitude. Now, before we get out of here, is there any last thing you would like to share with my audience?
I think I just want to say, we've talked about authenticity and alignment, but don't let that be another thing that you should do. It should be the easiest thing in the world. We're talking about letting go and being yourself, not forcing yourself to be a certain way anymore. And so if you feel any pressure coming from our discussion, check in with yourself. You're okay. And see if you can just start to let go a little more, be yourself a little more, and enjoy it. And I so appreciate you having me here and you having these conversations, because you take us nice and deep, and it's a wonderful thing. And yes, I want everyone to discover the grace and love that I was given. And hopefully I have still many, many, many miles and light years to go, and it's just going to keep getting better and better.
I love that. Now, if anyone wanted to work with you, how would they find you?
They can find me at joymasterymethod.com, and there's a link there to purchase the book, and then at the bottom, if you want, and then at the bottom you can join a free 31-day email sequence called Joy Expanding. So you just put in your name and email address, and you'll get an email for every day for the next 31 days to spark some joy in your life.
I love that. It's just a reminder that everyone should follow their joy. It's an innate feeling just because you want to do it, not for any rhyme or reason, but I think that that's guiding you to this bigger, higher purpose. And so thank you for speaking on that and writing on that. I've enjoyed this conversation, and I hope you did too. So just thank you so much for being a guest.
My pleasure.
Thanks for listening to another episode of Myofascial Health. I help myofascial release therapists create beautiful websites for their MFR practices, even if they aren't tech savvy. If you're just starting your MFR practice, or you're an experienced MFR practice owner, learn more about how I can help at www.myofascial.health/website.